Thank you again, everyone, for joining us today. We will begin in just a few minutes to allow people to enter the room before we get started. Welcome, everyone. Thank you for joining us today on our session on tobacco control and NCD prevention, key pieces of the pandemic recovery puzzle. I'm Marie, and I will be your technical facilitator today. For assistance, please use the chat function to message anyone with the title Technical Facilitator in their name. Before we get started, I have a few technical notes to explain. If you'd like to contribute a perspective, idea, or thought, please use the chat function. If you would like to ask a question, please use the Q&A button. You can find both of these features at the bottom of your Zoom window. Please note that this session will be recorded for documentation purposes. We are also streaming live on Facebook to enable a larger audience to take part in the discussion today. For those of you just joining us, thank you for attending the session on tobacco control and NCD prevention, key pieces of the pandemic recovery puzzle. I will now pass the floor to Leslie Ray Farrat, the Executive Director of FCA. Leslie, the floor is yours.
Thank you so much. And good morning, good afternoon, good evening, everybody. And welcome to our side event at the High Level Political Forum on tobacco control and NCD prevention, the key pieces of the pandemic recovery puzzle. I'm not going to spend too much time in my introduction today, as I'll pass it over to our moderator to give a bit of an overview. I just wanted to start by welcoming everybody. Thank you all for taking the time to come, and also just spend a quick minute going through kind of everything that we're going to cover today. So we are co-hosting this event with the NCD Alliance, and the objective of this event is to kind of highlight the critical cross-cutting role that tobacco control and NCD prevention need to play in contributing to sustainable development during and after the pandemic. We have about an hour and a half today to spend some time with everybody. And we'll start with a brief presentation from Nina Renshaw, the Director of Policy and Advocacy at the NCD Alliance. And then we will hear from multiple speakers that I will let Nina introduce to everybody. But the topics will be divided up into three parts. And the first part will look at tobacco control and NCD prevention as key components of sustainable approaches to post-pandemic recovery. We'll have a second part that will address NCD investment cases as tools to catalyze attention and action for scaling up NCD prevention. And a third part that will look at tobacco control and NCD prevention and how they can be integrated into COVID recovery plans through tobacco taxes. All of that should take about 45 minutes or so. And then we have a good 30 minutes to bring in some questions from the audience, followed by some summaries and next steps. So I will stop there and I'll turn it over to Nina, who is our moderator for this session. Thank you all, and I hope you enjoy our event.
Thank you so much, Leslie. Welcome everybody on behalf of NCD Alliance as well, one of the co-hosts today. Lovely to see you. Yes, the topic of today's side event to the High Level Political Forum is tobacco control and NCD prevention, key pieces of the pandemic recovery puzzle. So we're really looking forward to having a discussion with our expert panelists in just a second, and to hearing from you in the audience as well. You have the opportunity to ask questions, as Leslie said, so please do put those in the Q&A box as we go through, and in case our speakers inspire any thoughts, please feel free to share those in the chat box as well. And we'll have plenty of time in the discussions to bring your questions in as well, which I'm very much looking forward to. So I'm delighted to introduce our expert speakers for today. You're about to hear from Andrew Black, who's joining us from the Secretariat of WHO's Framework Convention on Tobacco Control, where he leads the Development Assistance Team. Professor Jeffrey Drope, who's from the University of Illinois at Chicago School of Public Health, where he researches the nexus between public health and economic policy making, looking at major NCD risk factors, so tobacco, alcohol, unhealthy food, and physical inactivity. Ryan Forrest is the Associate Director of Policy and Advocacy at the Framework Convention Alliance. Assistant Secretary Teresa Habitan joins us from the Department of Finance from the Philippines, where her work covers fiscal policy and planning, and particularly tax reform. And Teresa's previously worked at the World Bank as well. And finally, Doug Webb joins us from the UN Development Programme, where he manages the Health and Innovative Financing team, working across both non-communicable and infectious diseases. He was recently UNDP's Senior Response Coordinator for COVID-19 and is part of the UN Interagency Task Force on NCDs. So what better panel to have with us today, and we're really looking forward to hearing your views on how policymakers can ensure a sustainable recovery from the pandemic and build back better and fairer in the future. Just a few thoughts to set the scene for today's discussions. COVID-19 obviously has shaken the foundations, both of health systems and economies worldwide in high income and low income countries alike, and completely upended the understanding of what it takes to be prepared for a pandemic. The response in the countries thought to be best prepared for an epidemic was completely undermined by a threat that was unforeseen in the health security rankings previously and overlooked, namely that countries and communities with high prevalence of non-communicable diseases, NCDs, have seen more COVID deaths and an even more profound and destabilizing impact on their health systems. We know that the vast majority of the over 4 million people who've already lost their lives to COVID-19 had underlying health conditions, as they're commonly known, but most commonly, this is hypertension, cardiovascular disease, and diabetes in particular. Studies have estimated that 60 to 90% of COVID-19 deaths were of people living with one or more NCDs. Looking ahead, over a quarter of the world's population are living with NCDs that put them at a higher risk of COVID-19, but we saw similar patterns with SARS and with MERS as well. So we know people living with NCDs are really at the epicenter of this pandemic and have been of other epidemics as well. As you all know in the audience, many NCDs, the majority are driven by common risk factors. So tobacco, alcohol, air pollution, unhealthy and junk food, physical activity. So we're going to focus on one of those major risk factors today, tobacco, which in itself takes over 8 million lives every year. But much of what we're discussing can be applied as well to those other risk factors, alcohol, junk food, and pollution. And we've seen that during the pandemic, the industries behind those risk factors, behind those common causes of NCDs, have been exploiting the crisis to step up their tactics and gain political influence. A study that we've undertaken with the Spectrum Consortium of academic institutions has found that their tactics now have included increasing offering donations, partnerships, and shifting their marketing and promotional tactics to reach people under lockdown conditions, and especially youth and children. So there's a really real risk that the NCD pandemic is going to get worse without urgent policy action and factoring that into the recovery. We're learning now the hard way that government's long-standing inaction on these risk factors has amplified the human and economic toll of COVID-19. And as policymakers are seeking to respond, recover, and prepare better for future health threats, this is a vital opportunity to reassess priorities, policies, public spending, and address the previously missed opportunities to build healthier populations and, as a result, more resilient health systems. Looking at the themes of the high-level political forum this week, we know that action on prevention of non-communicable diseases will be central to achieving SDG 3 on better health for all, and in particular, of course, 3A on tobacco control, 3.4 on NCD deaths, and 3.8 on achieving universal health coverage for all. We know now that most countries are not currently on track to reach these by 2030, but importantly, they can be. That target 3.4 on NCDs can still be reached in all countries. A study that we undertook called NCD Countdown 2030, together with WHO, Imperial College, and The Lancet, shows that tobacco policies are really central and indispensable to that, need to be implemented and stepped up in all countries if they're going to reach the SDGs by 2030. So let's hear now from our excellent panel about how policymakers can move forward from here and make this a reality. So I'm going to hand over first looking at our panel to Ryan from the Framework Convention Alliance to talk about tobacco control, NCD prevention, and how these are key components of a post-pandemic recovery. So Ryan, how can the connection between tobacco control, NCDs, and sustainable development be brought to the fore in our recovery mechanisms? What's FCA's view? Where do we need to go from here?
Well, Nina, I think, as you suggested, the really co-occurring and interlinked nature of these two pandemics, NCDs and COVID-19, really highlights the fact that the global community has not taken sufficient action on NCDs and their risk factors over the past decade or longer. And as a result, far too many people have been left extremely vulnerable to the negative health and the economic effects of COVID-19. I think that what's going to be very, very important going forward is the need as a global community to acknowledge that we will not be able to have a healthy and equitable recovery from COVID-19 without action on NCDs and their risk factors. I think, you already kind of suggested this a little bit too, but the good news is that we already, as a global community, largely know exactly what we need to do to reduce the prevalence of NCDs and their ill effects in our societies. There's no shortage of policy guidance, strategies, frameworks, and action plans to guide us, including things like the Global Tobacco Treaty, the WHO Framework Convention on Tobacco Control, or the WHO Global Action Plan for the Prevention and Control of NCDs, both of which really lay out a set of proven evidence-based interventions to tackle NCDs and their risk factors. I think in the context of COVID and the massive economic effects that it's had, I think that it's going to be particularly important that we prioritize scaling up action on the so-called Best Buy policies, which are highly cost-effective population-level interventions to prevent NCDs by addressing their risk factors. And that includes things like taxes on alcohol, tobacco, or sugar-sweetened beverages, enacting and enforcing bans on tobacco and alcohol advertising and promotion, enacting legislation to create smoke-free spaces, and a number of others. But there's plenty of very high quality global evidence to show us that these policies are not only highly effective in creating healthier populations by reducing the incidence of NCDs and preventing millions of deaths, but they also make a lot of economic sense. Small upfront investments in these policies, somewhere on the scale of just, $1 per person in low-income countries and $3 per person in middle-income countries for all of the Best Buys, can create, savings on future healthcare expenditure, boost economic productivity by preventing early death or disability that keeps people out of the workforce, and health taxes in particular can relatively quickly generate revenues for government, which I think is especially relevant at this, current point in time. And there are also great ways to accelerate progress on the SDGs and not just targets 3.4 and 3A. Tobacco control measures, for example, have a lot of spillover effects across the SDGs, including the targets on poverty, nutrition, pollution, and more, which can really, I think, help to address COVID's negative impact on many sectors of society beyond just health, like social services and the economy. So I have a feeling that some of the colleagues on this call maybe will speak a little bit more about these kind of policies and the evidence for them and their impacts. So I won't go on at this stage, but I think just to say that the COVID-19 pandemic is a very clear and urgent call to action to accelerate the pace of progress on tackling NCDs and their risk factors, and that we do have the tools that we need to do better than we were doing before COVID hit. It's maybe a little bit too early to say that we're post-pandemic right now, but I do not think it's too early to begin to kind of take action to implement these population level preventive measures and to find opportunities to sort of integrate them in pandemic response and recovery plans or as part of longer term efforts to strengthen health systems.
Thanks, Brian. That's great. Absolutely. And I want to turn this over to Doug Webb from UNDP now to talk about response and recovery plans and what UNDP is seeing on that score. To what extent are we building back better, do you think, Doug? And what do we need to do to actually get there from here?
Hey, Nina, how are you? Good to see everybody. Well, in the response world, in the COVID response world, there's this sort of rush to include everything in the COVID response. There's the assumption that inclusion basically means effect, and I think this is probably a bit of a mistake. We're all running around trying to understand that if you sort of ram, the wording into a response plan, that it'll magically appear in reality. And there's probably an overemphasis perhaps on this idea of the recovery agenda being the answer to all of our problems. There's a couple of things I just want to stress here. The recovery itself is perhaps a bit of a myth. We're going to go into the cycle of response and recovery and preparedness actually overlapping for some time. This isn't going to be a linear route way out of this. We're going to go into these troughs and peaks of response and recovery for some time. So we've got to remain agile, sophisticated, nimble, and look for the connections. The actual COVID socioeconomic response plans, their lifespan isn't going to go beyond probably the end of December. And then they'll be folded into UN national responses. So the emphasis on the socioeconomic response plans for COVID is, we don't want to overemphasize this point. At the same time, we had a look at these response plans. We analyzed about 71 of them, looking for how governments had included particularly tobacco control in the plans themselves. And we found that 13 of them had included tobacco control in the plans. And interesting, 11 out of 13 of these countries which had included them were countries where we'd actually gone in and done these investment cases with WHO and other partners and the Framework Convention Secretariat, which actually demonstrated to us that once you raise the consciousness of the Ministry of Health, you actually elevate the issue in a state of readiness for other health-related threats, and you make those connections. And perhaps for me, that's the key point, that you raise the ability of a Ministry of Health to see the connections between different health conditions and their relevance. But in these plans themselves, Cambodia, for example, put provision of NCD services and tobacco cessation into primary healthcare and smoke-free environments, and actually specifically mentioned the Framework Convention in their response plan. Georgia articulated a whole of government and whole of society approach to tobacco, alcohol, pollution, and a healthy diet. Sri Lanka called for the exploration of innovative taxes on health-harming products to financing the COVID-19 response and recovery. So the response plans themselves are going to be, they're a short-term step to a much larger, a much longer process. There's probably two elements I want to just emphasize in the sort of the COVID sort of what it's really given us hope for here. One is this idea of the digital area. It's important to understand that what governments have now done is that it's now seeing public services in a much more efficient manner. And we're seeing health systems and the digital space and efficiencies in a much more sort of connected space. And the public sector is being much more connected in a way that it's never been connected before. And all of the health sector, and this, I'm mentioning this specifically for tobacco control, can actually start looking at how it can capitalize on this digital space. And the other is in the greening of the response. And there's a lot of connections in the tobacco control arena around the environmental connections in Article 18 particularly, which there's a lot of resources going into that kind of syndemic conversation, which we can look at as well. So what the COVID response, we can talk about this for a long, long time, but the COVID has done is raised a lot of opportunities for which the tobacco control agenda can actually plug into, which weren't necessarily there before.
Thank you, Doug. Thank you for raising those perspectives. And yeah, this cycle of response, recovery, preparedness is an important one that we're looking beyond the short-term timeframes. You mentioned the Framework Convention, so this is the ideal moment to bring in Andrew Black from the Framework Convention on Tobacco Control Secretariat. Andrew, I want to put this to you. Are you concerned at the Secretariat about the pandemic, the response to the pandemic overshadowing the response to the global pandemic of tobacco harm? Or how do we marry these two together better to make sure that we have an aligned agenda and a kind of win-win response that speaks to both?
Thanks very much, Nina, and hello to you, and greetings to everybody who has joined the webinar from the Convention Secretariat in Geneva. It's very good to be with you all today. So thank you, Nina, for putting the question to me. And I think it's very important that we remember that tobacco use is a global epidemic in its own right, and that this tobacco epidemic is taking place alongside the global COVID pandemic. We've already heard the fact from you, Nina, that each year tobacco kills more than 8 million people around the world. So more than 7 million deaths are from direct tobacco use, while about 1.2 million are from people being exposed to the harmful effects of secondhand smoke. So what we're talking about is a significant health problem for the world, and it relates both to direct smoking and to people being exposed to secondhand smoke. And of course, these numbers are staggering. There's no doubt about it. People are dying from non-communicable diseases associated with tobacco, and these diseases are ones that we all know very well. But of course, we also must remember that tobacco makes people more vulnerable to morbidity and mortality from communicable diseases, including COVID and other diseases as well, such as tuberculosis. And to have more healthy and resilient populations post-COVID, populations that are able to better withstand health emergencies that we might face in the future, we must end the tobacco epidemic. Just to say a little bit more on the point that Ryan raised, tobacco negatively affects sustainable development across all of its three dimensions: social, environmental, and economic development. The FCTC, the Framework Convention on Tobacco Control, is an accelerator for SDG achievement. So an analysis that we undertook with UNDP, in fact, showed that around 67 SDG targets can positively be influenced by strong FCTC implementation, with a good number of those targets outside of the health and wellbeing domain. So for this reason, we should be looking at the power of the Framework Convention on Tobacco Control, not only to help to improve public health, but as a way of really advancing sustainable development in a wider sense. The FCTC was designed as an evidence-based blueprint for what countries need to do to end the tobacco epidemic in their own countries. The FCTC, of course, can also serve as a model for other international public health instruments, such as a global pandemic preparedness treaty, for instance, that is currently being discussed. So I think that the FCTC, represents a really powerful tool in helping to shape our response to COVID. Helping to shape our ability to build back better, especially in terms of creating a stronger, more resilient, healthier societies. So thanks very much, Nina.
Thank you, Andrew. That's very, very clear on ending the tobacco pandemic at the same time as the COVID pandemic that's front of mind at the moment, and how it brings us benefits across a whole swathe of their SDGs. We're going to zoom in now more on the economics, the health economics of action on tobacco and how we build back better. So we're going to bring in here the rest of our panelists and talk about the investment cases that both Doug and Ryan already alluded to as a effective accelerator for policy action. So I'm really keen to follow up on what Doug mentioned before about those 11 countries that have taken this forward, and you're really seeing the results of the investment case advice that was requested by governments and provided by you in their policy responses and their moves forward now to recover better. First of all, I'm going to turn to Professor Drope from the School of Public Health at the University of Illinois at Chicago. Can you tell us from your expert insights, from your research, what tools and arguments do we have, or does a policymaker have in their toolkit going forward from now, kind of through the recovery plans, but as Doug said, going beyond that as well?
Yeah, thanks very much, Nina. It's a great question. I think my colleagues have highlighted a lot of these really macro level solutions that frankly have a lot of micro level solutions within them. And I'm going to betray my own biases at the moment and make a plug for improving excise taxes on unhealthy products. My own work focuses mainly on tobacco, but not exclusively. We also look at alcohol and sugar sweetened beverages and other unhealthy food products. Right now, we actually are working in 14 different countries trying to get those governments to improve their tobacco excise taxes. And it's sort of it's funny, it's a no-brainer in the minds of economists. We know that if you increase your specific taxes on products, it's going to raise the price of those products. And in fact, we counsel them to employ a uniform specific tax because it's the easiest one to implement, and we find it actually has the best effects for both health and for revenue. But what happens when we raise the taxes is the prices go up and consumption goes down. And with lower consumption of, and in our case, we're looking at tobacco, but it works the same with alcohol. You get lower healthcare costs because you have a healthier population. And perhaps more importantly, you actually have much higher productivity. And in fact, most of the economic gains are in the higher productivity, not in the lower healthcare costs. And a lot of that is in fact an artifact of the fact that these countries, in fact, aren't spending that much on healthcare in the first place. But nevertheless, the gains are enormous. We know that these goods, certainly tobacco and alcohol, are inelastic, which means the decline in consumption is going to be proportionally less than the increase in price. And this is actually a really good dynamic because it means as the consumption goes down, the revenue still increases. And this is where it's attractive to, for two reasons. It's attractive to ministries of finance and their revenue authorities because their mandate is to make sure that there's sufficient revenue to help fund the government's activities. But from the perspective of building back better for post-COVID-19 recovery, this actually generates revenues that can be allocated, I think, thoughtfully towards those types of programs. We also generally see that when the money that is generated from increased taxes is allocated back towards, I would say, sort of pro-development policies, health and education, we really see the follow-on effects in a positive way. So we see this both at the macro level when governments are spending better. We see the increases in terms of healthier societies and economic growth, but we also see it at the micro level, at the household level, which is quite amazing, in that we see that households that spend less or spend none, ideally on these products, are actually then reallocating their household income towards healthier things. And we've done this in a number of countries in which we work, and it's unequivocal. So there's no big secret here, which really begs the question: why aren't governments knocking the doors down to try to do this? And we've been a little bit puzzled by this, to be perfectly honest. I work, as I said, in more than a dozen countries, and we're not having the type of success that I would have expected under the current circumstances. And I think there are a couple of reasons for this. One, I think that ministries are overwhelmed. I think this is a very challenging time economically for many, many countries. And I think this is a big reason. It's just these folks have so much on their plate that they can't concentrate on a whole lot of things. And I think this is a legitimate reaction, but I really strongly encourage them to take a different track, because I think it's an enormous lost opportunity if steps aren't taken. The second thing I would say is there's sometimes a lack of technical capacity. And what I would encourage my colleagues, either who are promoting this in their own countries or perhaps are here from ministries on this webinar, is that technical help is available. Our team gives it, WHO gives it. There are a number of resources around the world that can help provide this type of help in terms of helping countries to raise their excise taxes on these unhealthy products in the very most effective ways. But I would say a lot of the hesitation that we're observing is really, and I know, Nina, you mentioned this, we've seen these industries double down. I mean, they have dug themselves in hard. I have seen increased lobbying in many of the countries where I'm working, very aggressive. As you mentioned, we've seen increased corporate social responsibility activities, where they're donating personal protective equipment and really just totally counterintuitive things like that, where the tobacco industry is somehow protecting us. And as you said, also, we've seen really aggressive and altered marketing to appeal to the times, if you will. Marketing to people who are in lockdown, for example, very specifically. And so we're sort of seeing a perfect storm here. And again, what I really encourage governments to do is to look beyond this and to really resist all of this pressure and to make the right decision and not lose this opportunity, because we're going to need these revenues to be able to build back better. And we know that taxing unhealthy goods is a very good avenue, at least to start this. So I'll leave it there. Thank you, Nina.
Absolutely. Thank you so much, Jeffrey, for those reflections. I think you've hit the nail on the head there. It's really important for governments and policymakers to recognize those tactics for what they are. When you have one of the best known cigarette makers in the world donating ventilators to hospitals in countries that are really suffering under the wave of COVID, I mean, the irony is just too much to take, and recognize that for what it is. They're not there to help. They're putting a lot of those patients in the hospital in the first place. They're doing it to increase their, political goodwill, their bandwidth, their, lobbying room for maneuver. And as you say, there's a real threat that is working at the moment. So yeah, thank you very much for highlighting that aspect. In terms of, I wanted to take you up on those 3 points. Why aren't governments taking this opportunity to implement no-brainer policies? So industry interference, ministries being overwhelmed. I mean, we can talk about, hopefully that is temporary. It's fully understandable that both ministries of finance and ministries of health are currently absolutely overwhelmed and just dealing with the crisis, on their doorstep right now. But to what extent might this, once we're over this particular wave and vaccines are becoming a reality for more and more countries, maybe we can expect that to move ahead, but also lack of technical capacity, which is a point to bring Doug back in and talk about the assistance that the Interagency Task Force on NCDs offers to governments. So Doug, can you explain a bit more what you were telling us before about the investment cases that the task force and UNDP, WHO, World Bank involved there that you offer? And I mean, great to hear that Sri Lanka, that's a great example, is factoring health taxes, health levies in as part of their response. Can you elaborate a bit more on the tools and guidance that are provided?
Yeah, sure. I mean, this point about fragility, I think, is really important right now. There is a certain susceptibility of governments at this stage to commercial exploitation. Let's be very clear that governments are open right now more than ever, and the way that very often we are configured is that we, in the international communities, that we don't like working at the interfaces of systems. We tend to have mandates that restrict our ability to be nimble and look at the way that systems and syndemics and the integration actually works. So it's really important that we try and get over this problem of mandate silos. So I'm encouraged by this conversation, and we help governments tackle what whole of society, whole of government actually means. And the ministries of health are stuck in this constant problem of dealing with other parts of government. So when we go into the investment case process, we've done about 20 of these now on tobacco control specifically, and we come out with a finding that it's 2.2%, I think, on average, of GDP lost per year to tobacco. And we present that back across to government and we say, do you want to perpetuate these losses? Is that what you want to do? The answer is clearly, well, not particularly. Then there's a range of solutions, and it's decision making, it's convening of different stakeholders. It's basically a governance question. So the skill set that's needed to be built is in trade-offs, it's in negotiation, it's basically in decision making, it's in stakeholder consultation, it's bringing together different constituencies and being aware of the commercial determinants of decision making, particularly in the legislature and on parliamentarians and through ministries of trade and ministries of finance, where the vulnerabilities and weak spots are very often to be found. And we have to start building the abilities of governments to protect themselves from these determinants. And COVID has exposed these more than ever, really. So working under the auspices of the convention, Article 5, Article 5.1, 5.2a, is looking at the planning environment, looking at conflict of interest, abilities to determine what those conflicts of interest are, look at multi-sectoral coordination, the platforms for planning. Article 5.3 is just simply help governments put the basic infrastructure in play and have those national plans, look at NCD plans, look at their relationship with the wider sector plans, and look at their relationship with financing structures. All of these must connect. They can't happen in isolation. So the task force has pushed quite hard for the tools and the financing to be connected. And we now have a multi-partner trust fund on NCDs and mental health, which has now been launched, which will provide, if it's financed, some technical support around all of these tools to help governments get those basic competencies in place to help governments get the core skills around trade-offs and governance. Because if there's one thing that COVID has taught us, is that you can have a triumph of science in the form of putting vaccines together, but when you collide that with poor governance, it makes no difference. And you end up with perpetuation and even exacerbation of inequities. And that's what we're up against here, is triumph of science with the knowledge colliding with poor governance. And NCDs, in a sense, has been the story of that all along. So it's basic, back to basics, get the governance straight. Thank you, Nina.
Absolutely, thank you, Doug. The causes of the causes, or even further upstream, the causes of the causes, poor governance, and inequalities, NCDs, and now infectious diseases. These are really compounding each other. And as we were saying before, there's a real risk that our response to the pandemic, if not done right, is going to exacerbate all of this and increase the health gaps and the inequalities that we see. You just alluded to it. So are we seeing more demand? This is a question to both Doug and Andrew. Are we seeing more demand from governments for this kind of technical support? We're told, I think, increasingly regularly by WHO that this is the major area where member states, governments are going to WHO and asking for technical support. So NCD action plans, NCD responses, and also, Doug, you just referred to it, NCD financing, and it would be good to hear a little bit more about the multi-partner trust fund, which is about to launch. Maybe to Andrew first, are you seeing the same, that there's increased demand for kind of technical capacity and guidance as we respond?
Thanks very much, Nina, and I will answer your question after I've said a few other things, if I may. So the theme of this webinar is tobacco, and how do we fight tobacco, and how do we make a substantial impact on the global tobacco epidemic? Well, the answer is to implement the Framework Convention on Tobacco Control. I think that the power of the FCTC comes from the treaty's enormous power to bring countries, governments together to work in cooperation to advance public health. And I think that the issue of tobacco use is substantially more prominent because we have the FCTC, because governments from countries that have ratified the treaty get together every 2 years to discuss tobacco control, to make decisions relating to the implementation of the FCTC. I think that that having the FCTC and the convening power of the FCTC is really powerful. I think that we also need to keep in mind that that there are 182 parties to the treaty, meaning that the FCTC covers more than 90% of the world's population, and so we have a lot of interest from governments in tobacco control, and a lot of commitment from governments to do something about it. We have to do more, I think, and always be looking for opportunities to translate the commitment that governments have made in joining the FCTC into action at country level, policy action especially, to tackle the tobacco epidemic that they're facing at the country level. The beauty of the FCTC is that it was always designed to be evidence-based. And if governments implement the treaty in full, they will reduce tobacco prevalence and ultimately reduce avoidable death and disability. And of course, as we've heard already, there are also a range of additional benefits for sustainable development, outside of health, that will come about as a result of strong FCTC implementation. So to help with implementation, and to turn to the question, Nina, that you put to Doug and me, has there been an increase in interest in requests from governments for support for implementation? I think the answer is yes, but also the support that is made available to governments has increased as well. So I think that the demand has increased alongside the increase in supply of support that is available to governments. And from the Convention Secretariat, we have the FCTC 2030 project, which is a sustainable development-led project to support governments to implement the key measures in the FCTC in low and middle income countries. And we work very closely with our key delivery partners, WHO and UNDP, to be able to support countries through that project, which is a very popular project, and we're always having governments knocking on our door, asking to join the project. So under the FCTC 2030 project, we've been able to produce a range of toolkits to assist governments with implementation, especially to strengthen governance for tobacco control, to do more along the lines that Doug was talking about. So one toolkit in particular is about improving multi-sectoral coordination. And that is key to tackling the tobacco problem at both country level and globally as well. We need to have people from within and from outside of the health sector working together to tackle the problem of tobacco, and only then will we really be able to motor along and make meaningful impacts. We also have a toolkit on producing national tobacco control strategies, another important aspect of tobacco control governance, and we're always available to support countries who are wanting to revise and review or make new tobacco control laws. Of course, tobacco control laws are very important in helping to rein in the actions and the behaviours of the tobacco industry. In addition, I just want to put a plug in for the illicit trade protocol that has been made under the FCTC to help countries to fight the illicit trade in tobacco as well. So we've got a number of tools available, and I think that the demand is there and is in fact increasing for technical support and capacity building.
Thanks, you, Andrew. for outlining all those tools and the guidance that's available from the Secretariat. That's much appreciated. And it sounds like there's some literal building back better going on where you are. Apologies for that. Doug, can I bring you back in very, very briefly to just give us a quick introduction to the multi-partner trust fund that you mentioned on NCDs and mental health, because I'm sure many of our audience may not have heard of that yet. Thank you. Yes,
the MPTF was, it was signed very recently. It's been established by ourselves, UNDP, WHO, and UNICEF. And the purpose of the fund is to provide catalytic grants to governments to invest in exactly what we're talking about, this area of governance support in the areas of planning, in the areas of putting together support around coordination, in addressing legal obstacles, and looking at financing frameworks, which very often are built on these investment cases as we've been describing. So really looking at the sort of structural barriers, if you like, to galvanizing an NCD and tobacco and mental health response in the context of COVID. So this isn't being done separate from COVID. It's being understanding how COVID is actually both an opportunity and perhaps an impediment to a lot of this work, but it's a vehicle or a context in which we want to do this. So this is it's being launched over the next few months, and the committee is chaired by Dr. Tedros to get it moving. And as Andrew has alluded to, the biggest demands that we're seeing from member states is in the areas of the financing around taxation, helping improve the taxation environment, health harming products, and this area of getting sectors together, and the legal aspects of making sure that once we've raised the awareness around the importance of domestic financing and raising taxes, that it actually goes through a legislative process, where very often the economic arguments hit political realities and things get blocked. So it's trying to sort of move things through the system and allowing the political environment to follow economic logic. So it's designed to basically get the governance machine to follow the economic and epidemiological realities.
Thank you. That's a great introduction to the Multi-Partner Trust Fund. And yeah, audience members watch this space, certainly around UN General Assembly in September, I think, when there'll be much more to come on the Trust Fund. That all sounds very, very positive. Thank you all so far for, yes, explaining the support that's available internationally and from your organisations for countries and governments to use all the evidence base that we have in place, the investment cases and so on, to really start building back better. So this is a fantastic moment to bring in Teresa Abitan, who is Assistant Secretary at the Department of Finance for the Republic of the Philippines. So I'm really looking forward to this part and hearing how a government has already started to move on this. So Ms. Abitan, based on your experience, what role can tobacco taxation play in supporting broader health goals and funding pandemic recovery and where we go from here? And thank you so much for joining us. Over to you.
Okay, thank you, Nina. First of all, the Philippines has already undergone 3 tobacco tax reforms since 2012. Before 2012, our tax structure had multi-tiered rates for cigarettes, so it depends on the brand. So we took that away in 2012, and since then we've raised our tobacco taxes 3 times, and also introduced taxation of e-cigarettes and providing tax distinction between salt, nicotine, and fee-based vapor products. As a result of our tobacco tax increases, we are achieving our reform objectives of increasing money for the government and also reducing tobacco tax consumption. I think even more significantly, the share of tobacco tax, excise tax collection to our GDP increased from a very, very meager 0.3% prior to the reform in 2012 to 0.8% even in the pandemic hit 2020. And we expect it to go up to 0.9% by 2022 and 2024. So these 3 tobacco reforms tripled the share of tobacco excise tax collections from 0.3% to 0.9%. And at the same time, the volume of removals or the consumption declined from 5.8 billion packs in 2012 to 3.3 billion packs in 2020, or an overall decline of 42.5% compared to 2012. This meant that smoking prevalence has also gone down from 29% in 2012 to around 23% in 2015, the last time we took the survey. So the additional excise revenues from tobacco products enabled us to have a sustainable funding source for universal healthcare program, improving our health expenditures, improving health facilities all over the country, and also enrolling the poorest families under PhilHealth or the medical insurance. We're also able to allocate funding to tobacco producing local government units so that they would be they will be able to support tobacco farmers and helping them shift to other high value crops. So in essence, from 2014 to 2021, we were able to raise about 6.2 billion US dollars earmarked for universal health care and other health expenditures. And this has bolstered the Philippine government's capacity to respond to the COVID pandemic. Without tobacco tax collections, responding to the sudden public health and economic crisis would have been even more difficult. So amidst the COVID-19 pandemic, it's also critical to note that while the volume of locally manufactured cigarettes have declined by 41.4% in 2020 compared to the year before, we are also seeing a lot of the increase in tobacco excise tax collections, which means that we're keeping up with sustaining financing for universal health care and also for improving insurance coverage for more poor Filipinos. We're also seeing a rebound in 2021, so we're quite optimistic that we will be able to improve and raise more funding for our public health programs, as well as the economic recovery program. And all this is because we were able to provide public policy support increase via an increase in excise tax rates for tobacco products. And we hope to continue doing this in the foreseeable future. Thank you, Nina.
Thank you very much. So what advice do you have for other governments in terms of working to strengthen their taxation? It sounds like, you know, you have that evidence base there on the health impact and the revenues and also the predictability of revenue. So what would you share with your counterparts in other countries?
Well, first of all, I think we need to be very focused on the kind of policy framework which would surround tobacco policy reform. So implementing a good tobacco tax policy, we want to achieve better health outcomes by keeping tobacco products less affordable, particularly targeting the vulnerable sectors, such as the poor and the youth, since they are the most price sensitive. We also have to generate additional revenues for the government and allocate it to, earmarking it. It was a difficult decision to make in 2012, but we did agree to earmark at least 30% of what we collect. And now I think it's going to increase to 50% to health and social services. So our health taxes are contributing the bulk of funding for the universal health care. So in this sense, we're also achieving some equity because we reduce the vulnerability of individuals and families, especially those belong to the marginalized sectors. I think governments must also be very aware that advocating tobacco tax reforms, you'll always meet tactics from the tobacco industry. They'll accuse you of ensuring that smuggling will continue, that there will be illicit trade. They will file cases against you. They will say that you will lose jobs, or because of the higher tax rates, government will lose tax revenues. But that's beside the point, because if you can show them evidence, and there are lots of evidence from countries around the world, that actually increasing tobacco taxes can work both for increasing revenues and also for improving your health outcomes. And we also need to consider that a lot of political will has to go behind these reforms, and political will can be enhanced if ministries of finance, ministries of health can work together, not only together, these two important ministries, but also work with civil society groups which can advocate more strongly for these reforms. Thank you.
Thank you so much. I'm sure we're going to come back to the role of civil society in the discussion section later on. So I'll pick up on that point in just a moment. Now I want to bring Andrew back in to talk about examples that you're seeing in member states as well. What's being implemented at the moment? How can we concretely build on what we know and factor these into the recovery plans?
Yeah, thanks, Nina. What is clear is that that we need to include the FCTC in COVID recovery plans that are being developed nationally and globally, and also in sustainable development plans more widely. I think strategically, we all need to be promoting action to prevent the uptake of tobacco use in the first place by children and young people, to create healthier generations to come, and populations that will be more able to resist death and disability from tobacco and from comorbidities. And I think that we're seeing many countries now looking to be very ambitious in terms of creating smoke-free or tobacco-free generations. Really getting tobacco prevalence rates down to quite marginal levels, and I think that ambitious action is to be welcomed and encouraged. I think that we also need to continue to work on the arguments for tobacco control that will resonate with decision makers from other sectors. So, for example, we need for ministries of finance to recognise that we just can't afford to not tackle tobacco use, given that that more than 1.5% of the world's GDP is lost every year to tobacco. And while tobacco companies will go and knock on the door of ministries of finance to say that they are making important economic contributions, I think that the reality is far different. The reality is that tobacco costs economies far too much, and the tobacco companies will never be able to match what the wider economic costs of tobacco are at national level. And I mean, did you know that treating tobacco illness represents about 6% of global health expenditures every year? I mean, it's just such a costly habit for individuals and for countries as well. So other action that is needed is to promote the passing of robust legislation, especially to stop the tobacco industry's advertising and promotion, which is often these days directed to young people and to women. We need tobacco control laws to cover both conventional tobacco products as well as the novel tobacco products that we're seeing on the market now, such as heated tobacco. And once enacted, these laws need to be strongly enforced. And just turning back to a point that's been made a few times already, but it's an important one. Laws on tobacco advertising, promotion and sponsorship must end the tobacco industry's so-called corporate social responsibility activities. We've seen over the COVID pandemic that the tobacco industry has been trying to rehabilitate its image through its CSR activities, and that really must stop. And of course, let's not forget the role that strengthened tobacco taxation can play in helping to fund COVID recovery and also to strengthen public health. Thanks very much.
Thank you, Andrew. I want to bring Ryan back in here. Can we hear from FCA your perspective on this? What are the key things? What are the starting points from governments as we move forward?
Thanks, Nina. Sorry, it just took me a moment to unmute myself there. I think, what the other speakers have really highlighted is that substantial increases in tobacco taxes are going to be really, really critical. The revenue generation potential of these taxes is particularly relevant and important in the context of COVID-19, and really, I think, can't be undersold. Governments are facing these huge declines in revenues as a result of the big economic turndown last year. I think that the estimates of are somewhere sort of on the scale of about $12 trillion globally. And at the same time, they need to find the fiscal space for continued public spending on, essential health services and social supports and investment in future pandemic preparedness. So increased tobacco taxes and, perhaps also taxes on other unhealthy commodities like sugar sweetened beverages or alcohol can play a really important role, I think, in generating the revenue required for this and, addressing some of the massive budget pressures that governments are facing. I know that there was a recent study put out by the Center for Global Development, which actually suggested that LMICs could raise up to 0.6 to 0.7% of GDP in additional tobacco, alcohol, and sugar sweetened beverage revenues as sort of a short to medium term revenue benchmark, which I think would go, a very, very long way towards addressing these gaps that governments are facing. And, I think as Jeff suggested, and Ms. Habitan has also talked about, it can also really help governments maintain their ability to continue spending on health, which is particularly important in the context of COVID recovery. I guess I would also just sort of, echo Andrew too, and say that, we'd be remiss if we did not use this as an opportunity to kind of scale up our regulation of the tobacco industry as a vector of the tobacco epidemic, including through our implementation of FCTC Article 5.3, which seeks to protect public health policies from the commercial and vested interests of the tobacco industry. We've really seen how the industry has used this pandemic as an opportunity to promote itself as part of the solution to this crisis, and has also very much sought to downplay the risks that tobacco products pose with respect to COVID-19 outcomes. So we need to recognize that the tobacco industry is not part of a healthy recovery from COVID-19. We need to denormalize its activities and, really put in place policies to limit its ability to influence government policy and, to continue to propagate the tobacco epidemic. So I think as Doug suggested in his earlier remarks, that probably needs to include some basic investments in building the governance capacity of governments to really effectively deal with, for example, conflicts of interest in the public service. We need to really use this as an opportunity to raise awareness at all levels of government about the true purpose of industry CSR activities, to ban these activities in countries where this has not already been done. And, perhaps even looking to things like removing incentives from these companies and excluding them from any government recovery packages.
Yeah, absolutely. That's something that has floored me throughout. That these industries, not only tobacco, but also alcohol has been doing this to a large extent as well, demanding that they have a part of kind of bailouts during the pandemic, completely overlooking and obviously trying to overturn the fact that they've had a role in undermining the health of populations, which has made us so vulnerable, and especially made certain marginalized and disadvantaged communities even more vulnerable. So broadening those health gaps at the same time. I'm really glad you raised that point. I think we've covered a lot of ground and we're getting questions flowing in now from our audience. So I'm going to take the opportunity to start putting these to our panelists. Certainly we will take up stakeholder engagement and decision-making and civil society's role in that in just a moment. I want to, first of all, come back on a couple of questions that have come in on the kind of economic arguments. So this would be a question to Teresa Habitan and to Jeff as well on earmarking. I thought this was really interesting to hear from you, Jeff, an argument in favor of earmarking. Usually economists are not big fans of earmarking. They'd like to see it go into general revenue and taxation and used for whatever purposes the government sees fit. But your argument for earmarking, what do you advise ministries of finance when they're seeking your advice? How do you justify earmarking from an economist's perspective when you're talking to them? It must be quite hard to convince them to dedicate it to health purposes.
I can see my colleague at the ministry smiling, so I'm going to be careful how I answer this. So let me actually step back and explain why in general economists don't like earmarking. They're typically inefficient, right? Because things get earmarked from a specific policy, say tax policy, and then it generates revenues. But then that revenue stream gets trapped, if you will, in a specific place and for specific things that might change over time. And as we all know, policymaking isn't as fluid as we would like it to be. So we'll often see, and I've seen this in some countries, where money is going into a fund where they can't even spend the money efficiently and thoughtfully, and that's a real problem. And so rather than, I don't like the word earmark, and I typically don't use it in my conversations with my colleagues at ministries. And I find, generally speaking, most of them don't like earmarks because they like the flexibility. But instead, what we really encourage is that a type of allocation of funds happens where funds are allocated more generally. And I'm going to actually spotlight the Philippines because I think it's a great example. And this way, she doesn't have to toot her own horn. I will happily toot her horn for them. But some of the things that I saw the Philippines do, I would call, really fantastic practice. A lot of the money, for example, most of the money was allocated towards universal health coverage for the poorest Filipinos. That's brilliant, right? Because we know that money is never going to be poorly allocated because there is such a huge need for those types of resources for this specific issue. And I would say that's probably true in almost all low and middle income countries, that you could put a very large proportion of your tobacco tax revenue towards universal health coverage, and that money would be used wisely. Similarly, I know in the Philippines, they allocated money towards improving actual health facilities. And again, I think that's a really a fantastic way to allocate that money in a general way, but also a targeted but general way, if you will. And I think that is a way around, a very specific earmark. Again, the Philippines and a couple of other countries actually target some money to help tobacco farmers make a shift to alternative livelihoods. That's a very politically and economically sensitive issue in many countries. And again, it's one where I think for many years to come, those funds can be used really wisely, and I wouldn't really worry about them being used inefficiently. So earmarks are a funny and sensitive issue, but I really think we can overcome this thoughtfully and by making these general allocations. But I really like to hear from my ministry colleague.
Yes, please, Teresa, jump in. We'd love to hear whether this was a tough sell at home with your colleagues in the ministry.
It was a tough sell for us to convince us, but at the very beginning, we decided that for us to be able to sell it, it has to stop being seen as only a revenue raising measure. And for context, because the first sin tax reform law was signed in 2012 was at the time of the administration of President Aquino. And when he was a candidate for president, he said that there was going to be no new taxes. So it was difficult to sell this proposal, and we said, okay, so why not sell this as a public health measure instead of a revenue raising measure, and which is what we did. And in the course of negotiating it with Congress, which is something very challenging. I don't know in other countries, but especially in the Philippines, it's a very challenging task to convince our Congress to deliver reforms on the tobacco industry prior to 2012. And the way to do it was to say that a significant portion of the collection from this reform will go to universal health care. So that was, we agreed very early on that. And yes, the question about earmarking is something that we tried to package in a way that it was not a hard earmarking, but what you call a soft earmarking, that we only, it's understood that certain portions will go to the Department of Health for this type of expenditures. And I think in hindsight, we're glad that we did that, because faced with the pandemic in early 2020, we knew that we had bolstered our health systems, probably not to the extent that we wanted to have improved it, but certainly we poured in investments such that we were able to meet the needs that suddenly confronted us in 2020.
Thank you. And I mean, that's, I would hope, a hard lesson for your counterparts in other ministries to take away from the pandemic. Could we have done better? Could we have been better prepared by acting on NCDs, acting on the risk factors, and you know, making use of some of these fiscal tools that there's you know, a very strong evidence base and all this international support available for. Thank you very much for bringing that up. While I have you, Teresa, if I may, can I ask how stakeholders were consulted in this process when you were revising your taxes and your tax reform process? Is this something that you engaged with civil society and others as you were moving this forward and kind of gaining the support of the general public as well? It sounds like this package, especially with that soft earmarking for UHC and the most vulnerable groups in society. Yes, how was this built together with in a consultation process?
This was the first tax policy advocacy that we did when there was a very active civil society engagement that happened. And it happened very early on as we were still packaging the kind of structure that we wanted to establish with this reform. And at the time, we were also doing it for alcohol. So it was a twin reform. So it was for tobacco, it was also for alcohol. And the civil society engagement that happened engaged doctors. So I've never met so many doctors in my life at any one point. So there were doctors, there were economists, and we had also public media personalities who helped us to craft our communication, the messaging, because that was important. It was really we needed a lot of help, and we got a lot of help because I think we reached out to ask for this help from the civil society, and it was a good experience and something which we replicated for succeeding reforms, policy advocacies that we did. Yeah.
That's really encouraging to hear. Thank you so much. I want to bring Ryan back in now as we're talking about civil society. Looking at the funding gaps from your perspective on tobacco control and NCD prevention more broadly, where do you see the gaps? I mean, we're talking here about taxation and domestic resource mobilization, but do you see gaps in other areas as well and ways that we can move forward and plug those?
Absolutely. I think that there are also really, really huge gaps in external funding for tobacco control. And there is really a role for external funding in, you know, supporting capacity building for tobacco control until, for example, such time domestic resource mobilization is able to generate enough funding for sustainable tobacco control. We saw that, you know, last year only about 1.2% of all development assistance for health was allocated for NCDs, and funding for tobacco control accounted for an even smaller fraction of that already, you know, very minuscule amount. So I think that this was, you know, wholly inadequate before the pandemic when we consider that NCDs account for 60% of the global disease burden and 70% of all deaths globally. But even more so now, I think that we need to really put pressure on donors, I think, to not just maintain but scale up their investments of development assistance for NCD prevention going forward, which I acknowledge will be a challenge, I think, given the domestic budget pressures that I think many donor countries are facing in light of COVID. And I think we also need to think about alternative and novel ways to mobilize resources on the scale needed to adequately scale up tobacco control and NCD prevention. I know there's been some mention on this call already of the catalytic trust fund for NCDs, which is under development. And FCA is also trying to support some discussions about perhaps a tobacco specific mechanism that could mobilize and then direct resources to where it needs to go to scale up FCTC implementation.
Absolutely, and maybe I could bring Andrew back in on that point as well. In terms of where the resource gaps are and kind of other funding sources that you see that can be useful in our work as well. I think the Commonwealth Secretariat has also been engaged. So maybe you could just talk us through some of the other options that you see from the Secretariat as well.
Thanks very much. There's no doubt that that the world could use more resource for tobacco control. So that's almost goes without saying. The question is how to secure that funding from the Convention Secretariat. We are working closely with development partners to see how they can continue to support the development assistance activities that we have underway, and in particular the FCTC 2030 project. But the best way to secure funding for country level work is for governments themselves to identify tobacco control as a priority, to identify FCTC implementation as a priority, and to include that as a priority in their SDG plans and the country cooperation plans that they have with the WHO, for instance, because development donors need to see that a government is committed, needs to see that there's political commitment to FCTC implementation before funding can be made available. And by putting and highlighting the FCTC within these country development plans, that's the best way of being able to secure resources, and for governments actually to be asking development donors directly for help to do tobacco control. I might suggest that that Doug be asked to give a few views on this particular question as well, because he has a lot of expertise in this area. So maybe handing over to Doug. Thanks.
I'll take you up on that. Yes, over to you, Doug.
Thanks, Andrew. I mean, tobacco control ultimately should be domestically financed. I mean, that is absolutely true. And what we're doing through the FCT 2030 project is demonstrating what a quite modest investment can actually do in terms of the relationship between making a case for tobacco control and then stimulating policy responses around various articles. And I think we've done that. We're cataloging those impacts as we speak, and ultimately a national plan for the implementation, which is connected to larger development plans with their own domestic financing frameworks, with an elevated tax base, is where this is all moving to. So that is the sort of broader vision, and we've got illustrative examples of how to actually tactically move in that direction and what capacities are required to do that. That's our modus operandi that we've been working around, and who needs to be involved and what partnerships are effective. The other thing I should say about financing is not to lose sight of the pandemic preparedness treaty or convention framework or whatever it'll be called, and to recognize that if that is only restricted to nasty pathogens or unknown virus X's, we've probably lost a big opportunity. If COVID has taught us anything, it is the relationship between underlying chronic conditions or vascular vulnerability, if you like, and susceptibility of individuals to in this case a coronavirus, but other viruses more broadly, and that you've got to then address, in terms of disease and pandemic preparedness, chronic conditions and non-communicable diseases and their causes. So it's super important that the treaty negotiations that have already probably started take into account these conditions and their causes. because there will be money coming in on the back of this framework convention. There's no doubt about it. It's just too important. So the elevation of the FCTC as the precursor of this convention is going to be a really important positioning of the FCTC on the international political governance sphere, in terms of, is the FCTC a good example? Does it work? Has it had an impact? How does it work in terms of its governance arrangements and so on? And how does it connect and can be amplified in the current conversation around pandemic preparedness? Because pandemic preparedness means the implementation of the FCTC as well. That's the really important message to make at this stage. Thank you, Nina.
Thank you very much, Doug. Yes, I promised more of a conversation picking up on audience questions about stakeholder engagement and policymaking. And that might be in the recovery plans or in the national NCD plans. Would any of the speakers like to come in on that and speak about your views on stakeholder engagement? I can't see you very well. I'm just looking to see if you come onto camera and I can see you and bring you in on this conversation. Doug, could I bring you back on that? How are stakeholders engaged? Yes, do you think in the national plans and the recovery processes so far?
Have stakeholders been involved in the recovery plans?
Or indeed, I mean, from your perspective, how are the other kind of UN institutions, how's the whole UN family kind of feeding into those response and recovery plans to make sure that they really are building back better and fairer in terms of the rhetoric that's coming across from the UN as well?
The UN is working probably more closely on this than it's worked on any other issue before. It's almost to an obsessive amount. Whether it is then reaching outwards is probably a pertinent question. So I don't think there's necessarily a worry about it working internally. It's about us working outside of our normal sort of boxes, in a sense. So I think that, looking ahead, as always with these things, it's getting the right configuration at country level, and are looking at the COVID partnership structures on the ground can always tell us the same thing, that the partnership structures haven't been that effective. They haven't really built on civil society arrangements that have been effective for previous pandemics. For example, the HIV community, which has been dealing with viruses for how long now, 30, 40 years, has not been mobilized as an asset for the COVID response, in terms of all the work that's done around community mobilization, destigmatization, and all the things that it does very well, has not been mobilized en masse. So we tend to just, I mean, the point is quite simple here, that whenever we have a new threat that comes at us, we try and push out new institutional configurations and arrangements, when actually the answer is already sitting there, which needs to be repurposed and then put forward. And we waste a lot of time trying to make up new stuff. And I think that, we made that mistake again to a large extent with COVID. So the skills and assets that are already there in tackling these pre-existing situations and conditions actually just need to work together much better. And preparedness going ahead is going to be about how those constituencies situate themselves working together. And I don't think that's been done very effectively up until this point.
And I mean, coming from somebody with your experience in the HIV response, Ebola response, and now COVID, having been at, very much at the heart of all of those within UNDP and other agencies, that's a really useful lesson to learn, which, as you say, we don't seem to have taken on board just yet. And I definitely hope that when, member states are feeding into the negotiations, which are literally starting this week on the pandemic treaty, that this is something that's taken up as well. That civil society in particular and all of the learnings that we've had from the previous processes and those communities is taken on board throughout that process. Ryan, can I bring you back in there in terms of the role of civil society and how you would like to see civil society organisations being better consulted?
Yeah, maybe I could just say, I see a lot of civil society folks on this call, so maybe I could perhaps include a bit of a call to action for all of us. I think that, prevention is really something that's been left out of conversations to date on pandemic preparedness. There's much more of a focus on things like strengthening, our ability to detect and report on infectious disease outbreaks, or, investing in kind of the treatment or curative aspects of the healthcare system. I think that there's just a very urgent need to kind of shift these dialogues to make tobacco control and NCD prevention part of these conversations, and that this is something perhaps that civil society can, help to address. So I think it's about kind of really proactively seeking out opportunities at the global and national levels to push tobacco control and NCD prevention to the fore as governments engage in kind of, I think as Doug referred to it, this continual cycle of response and preparedness.
Thank you. And I mean, this is certainly something that the NCD Alliance and our members around the world, we've got national alliances now in around 70 countries, something that we're very keen to do as well. And with an emphasis on bringing in particular, the voices of people living with different NCDs to speak to how their personal experience can also inform decision-making. This is something that we strongly try and weave in, and that as part of a kind of COVID response and recovery conversations is essential as well. We are coming up on time, so I'll give the opportunity for our other speakers, if you want to come back on camera and share a few parting thoughts, if there's anything that you wanted to share with our audience that you haven't had the opportunity to do yet, please turn your camera back on and I'll bring you back in. Andrew was very quick on the ball there, so Andrew, I'll pass back over to you. Thank you.
Thanks very much. I just noticed that a number of questions have been asked of the panel about tobacco growing, and I just wanted to take a moment to address some of those questions. And the points that are being made are absolutely right. We need to tackle not only the demand for tobacco in terms of people wanting to use it, but also look at the supply of tobacco as well. And that's what the FCTC does. It's got specific provisions on tobacco growing, including a particular provision relating to working with tobacco growers that want to transition into alternative forms of livelihood. It's absolutely right for us to be looking at how we might be able to support tobacco growers to do other things, because tobacco growing is not very profitable. It's really hard work, and people who work in the fields, especially picking the tobacco leaves, can get sick from handling the tobacco leaves as well. And so for all of these reasons, we're looking at how we can mobilize more support for farmers to be able to transition to other forms of livelihoods. So this is something that we are thinking about. We've only got a few moments left, I know, so I can't go into any more detail probably, but to say that together with UNDP, we are looking very seriously at the issue of tobacco growing, and to say that the FCTC is pro-tobacco growers. The tobacco industry like to spread myths and misconceptions that the FCTC is about destroying livelihoods of tobacco growers, and that's not true at all. Thank you.
Thank you, Andrew. Thank you for tackling that myth as well. That's appreciated that you took up the questions about tobacco growing. Yes, there were a few that came in that area. Any others from the panel would like to share a few parting thoughts before we wrap up? Ryan, did you want to add anything?
No, I'm sorry, I was just touching my face there.
Oh, sorry. Okay, fantastic. Okay, in that case, thank you to the audience for all of your questions, and thank you so much to the speakers for all of the insights that you've provided today. They've been hugely useful, hugely instructive, hugely insightful from the perspective of an NCD advocate. So in terms of wrap up thoughts, I think we've covered such a lot of ground today. But just to kind of pull together some threads that came through from all of our speakers. And obviously the point that we're coming from to start with is that all countries can still reach the SDGs, in particular SDG 3.4 for non-communicable diseases, but also 3A on tobacco control. SDG 3.4 means reducing premature deaths from NCDs by 1/3 by 2030. So there's a huge amount at stake there, and it is still doable, but tobacco control has to be an absolutely indispensable part of that to get there. The pandemic context, we've been hearing about how the industry has used this to step up their interference, and that how governments need to be better protected from that, need to better protect themselves, but also need to work with the international community, obviously, to properly implement the FCTC and think about governance in how they're responding to the pandemic and any new institutions, frameworks, legal treaties, whatever that comes in response. That absolutely has to have governance at the heart, as we heard so strongly from Doug, and we need to do a better job across the board there in making sure that we keep unhealthy commercial influences in check. The other side of that coin potentially is fiscal measures, that we've heard how there is enormous potential there. It's been tried and tested, not least in the Philippines, where we heard that fantastic example that this is really a kind of a gold standard for tobacco taxation, and thinking about how that is earmarked to benefit the poorest in society and contribute to another one of the SDGs, and namely 3.8 on universal health coverage. We've talked a bit about the macroeconomic challenges facing governments, especially under the context of COVID, and why this resonates even more under those conditions. We've talked about how tobacco control policies and taxation in particular can contribute to equity and addressing health inequalities, which have been so prevalent and so much in the spotlight during the pandemic. What else did I want to add that's come through today? Of course, we've heard about the importance of stakeholder engagement and bringing in the voices not only of the affected industries. We need to think about a better way to regulate how affected industries have their voices heard through this process, but certainly people most affected. So the people that need health services, civil society, and the expertise which is already within the institutions and the organizations that you've heard from today, as well as with non-governmental organizations who can contribute so much to these processes and decision-making as well. So I think we're just about coming up on time. Thank you again so much to all of our speakers from today, to Ms. Habitan from the Philippines, to Doug Webb from UNDP, Andrew Black from the FCTC Secretariat, Professor Drope from Chicago, and Ryan Forrest and Leslie Ray Ferrat, our co-hosts from Framework Convention Alliance. It's been an absolute pleasure having this discussion with you all. Thank you so much for our audience as well for your questions. I do apologize that we couldn't get to quite all of them, but you have our contact details if you want to get in touch and continue the conversation. I'm sure the conversations are happening on social media as well, via NCD Alliance and via the Framework Convention Alliance, so we can certainly see you there to carry on. And we wish you a productive rest of your week at the High Level Political Forum, and we'll see you again next time. Thank you so much.